We are living longer, and that's a good thing. However, as we age, our ability to function independently can be threatened by a variety of different factors. Think about chronic diseases and the number of medications taken to manage these diseases. Limited or fixed incomes. What about occasional health events such as hospitalizations? All of this can trigger effects and complications that may result in compromising one's ability to do day-to-day activities such as walking, eating, dressing, cooking, or even going to the store. When older adults require assistance and support, many will rely on their family and friends. In the healthcare world, we call these family and friends family caregivers or informal caregivers. Typically, a caregiver is someone who provides assistance without getting paid. In the United States, about 34 million adults have cared for someone who is 50 years or above. On average, caregivers are 49 years old. Interestingly, 42% of caregivers are children of the person they are caring for, and about 12% are spouses. In the past, most informal caregivers were women, but recently, we are seeing an increasing number in male caregivers providing assistance to their spouses. Having a caregiver makes it possible for many older adults to continue living in their comfort of the homes. And again, that is a good thing. But imagine yourself as the caregiver. Let us say you are assisting your mother who has started to show signs of dementia. She's living with you. You have a full-time job, plus you are raising 3 young children, and you volunteer a few hours each week in your local community. Although it may be emotionally rewarding for you to be caring for your mother, it can also be exhausting and burdensome. You are aware that the dementia will worsen as time passes, so you may also be worried about your future. Well, you are not alone in feeling this way. Anxiety, depression, burden, and strain are frequently reported as consequences of caregiving. In 2015, the American Association of Retired People conducted a survey on more than 1,200 adult caregivers. Their data revealed that 1 in 4 caregivers reported at least moderate levels of physical strain. Further analysis found that those caregivers who had been caregiving for more than a year, living in the same household, and caring for someone with dementia were more likely to report a high degree of physical strain. Emotionally, almost 2/3 of caregivers reported feeling at least a moderate amount of emotional stress. What do this data tell us? Well, for one, when caring for older adults, we need to also be attentive to the needs of their caregivers. At Duke Health, we are doing just that. The Duke School of Nursing was awarded a 3-year grant from the Duke Endowment to develop and implement the Duke Elder Family Caregiver Training Center, or DEFT for short. DEFT provides education, skills training, and support to caregivers of elder patients transitioning home from a hospital stay. The DEFT team follows these caregivers for up to 2 weeks after hospital discharge with a minimum of 3 support calls. Take, for example, our caregiver, Dr. Ruby Drew, whose husband underwent abdominal surgery for pancreatic cancer. He went home requiring subcutaneous injections and wound care.
My name is Dr. Ruby Drew, and I'm a caregiver. In September of 2017, Jerry was diagnosed with pancreatic cancer. When his doctor in Asheville asked where he wanted to go for surgery, he said, "Ruby had such a good experience at Duke, just send me to Duke." So he had surgery on October 2nd. He came out of the surgery well. It was predicted that he would be leaving the hospital in probably 7 to 9 days. how to deal with stress, how to recognize delirium, how to set up your house for a person coming back who's shuffling around, how to get rid of drugs. And then I was taught how to give Lovenox injections, which is kind of fun for me. I like doing that kind of thing. And I'm all for learning what I can do to be better at what turned out to be much more challenging than I expected when we first started thinking about his surgery and the recovery. I had no idea I'd be doing the things that I was doing, especially wound care.
Ruby's husband, Jerry, is doing well. But as you heard from Ruby, her caregiving journey has been challenging. With DEFT, our caregivers report a high degree of satisfaction. In fact, they reported feeling more confident in their caregiving. Some mentioned how it was great to have that extra training and information, and others mentioned finding comfort in knowing that resources are a phone call or email away. We also believe that we can reduce hospital readmissions by utilizing the DEFT program. In the future, as we anticipate an increase in the number of older adults, there will be a parallel increase in the number of people caring for them. We must consider caregivers as relevant and vital partners in healthcare, and as such, we need to advocate for programs that support them, because that's a good thing.